What to expect when tapering off sublingual buprenorphine. In this telehealth visit, a doctor and patient discuss withdrawal and other helpful tips to keep in mind when discontinuing this medication.
Okay, so we've talked a little bit about the reasons you're considering stopping the buprenorphine, some of the risks and benefits. So what other questions do you have for me now?
I have a lot of questions. So the first one is, how exactly are we going to go about doing this? What's the process?
Yeah, good question. The idea is we want to gradually decrease your dose. That way we can assess every time we make a change how that's affecting you, and also hopefully you won't have too much withdrawal. Your body changes with the buprenorphine, and we want to allow you to have a chance to get back to normal. Every time we make a change, we can reassess the next visit and decide if we want to continue at the same speed or slow things down or speed things up, and that way we'll be able to really keep an eye on how things are going.
Okay, but how am I going to feel? Am I going to be, in withdrawal at all?
Another good question, and obviously something that is very concerning. So it really depends on the person. Some people experience almost no withdrawal, and it's really a smooth process to come off of the buprenorphine, and other people have a really tough time. Um, some people are experiencing sort of the usual signs of withdrawal that you may have experienced in the past: trouble sleeping, feeling irritable, maybe your mood is low, and then some physical symptoms like maybe some diarrhea, loose stool, maybe some aches and pains, feeling like your whole body hurts. Uh, at the same time, you can also be experiencing psychological changes, like you may not have had any cravings up till now, but as the medication level goes down and psychologically you realize that you could use, that may not be the case, and the cravings may return.
Well, hopefully I'm one of those people who doesn't really have any any
Yeah, let's
withdrawal.
hope.
But
Let's
if
hope.
I am, when should I expect to start feeling like some of those withdrawal symptoms?
Yeah. So one thing to keep in mind is it could be that you'll start experiencing withdrawal as soon as we make that first change and lower the dose. But a lot of people actually feel fine as they come down from the higher doses, from the 20s down to the teens, even down to 8 milligrams. You might not really have any withdrawal, but then all of a sudden, in the last couple milligrams, the withdrawal might appear. So that's something to just keep an eye out for, and that would be normal. And if that happens, we'll just have to reassess when we get to the last couple milligrams. Should we slow things down and find a way to deal with that?
Okay. Is there anything else I should know about?
Well, one thing I always tell people who are in this process is that coming off of buprenorphine seems like it's relatively easy. You've been doing well for quite a while now. You might be thinking, I'm confident, I'm feeling good, I no longer have this problem. But as AA and NA say, addiction is a cunning, baffling, and powerful adversary, and it's important to be vigilant in maintaining your recovery and realize that even though you've been fine and haven't had any cravings for such a long time, they could come back, especially as you come off the medicine. So just to be careful and be ready for that.
That sounds really hard. How can I make this whole process as easy as possible for myself?
Good question, and it's good to plan it out at this point. So it's good that you're thinking along those lines. Um, one thing is to just try to make sure you have a plan in case things go wrong, you get cravings or you have urges to use. Make sure you have support people available who, if a crisis comes, you can call them up, and hopefully one of them will be available to talk you through a problem. Could be family members, could be friends, could be other people in recovery. Another possibility that you can put in place. Another important piece I'd say is, if you decide you don't want to call someone, or you're not able to get in touch with anyone, have some things for yourself that will help you with relapse prevention, preventing you from going back to using. Maybe having a go-to TV show or movie or some other activity on your phone that if you get a craving, I'm going to try doing this and distract myself until the craving passes. Other people sometimes have a motivational message or a list of the reasons why you started your path to recovery in the first place. Maybe pictures of loved ones that you want to make sure you stay safe for. So having all those things available to yourself, so just in case something goes wrong, you can reach in and maybe have those right at hand. Those can all be really useful.
That all makes a lot of sense. But I've also known like some people who thought they were doing okay, but they ended up going back to heroin and overdosing.
Yeah, that's definitely a pretty scary thing. As I mentioned, you have to be vigilant. And at the same time, it's important to just remember that after you stop the buprenorphine, your body really goes back to the way it was before you first started using opioids. So you lose all your tolerance. That means that you're at pretty high risk if you do go back to opioids. Even if you maybe use buprenorphine at the dose you used to use, you may have an overdose. Whereas in the past, you could use this amount, you were using it every day and it was not really doing anything. Now you could use it and it could even kill you.
Wow.
So I always emphasize to people that if you do go back to using, make sure to use a really small amount to test it, make sure that the amount that you're using is safe. God forbid if you go back. At the same time, in the drug supply these days, there are potent opioids. Even a small amount could be deadly, like I don't know if you've heard about fentanyl and carfentanil. So it's also really important that if you do go back to use it all, have someone around who has naloxone or Narcan available so that they can, if you, God forbid, overdose, they can reverse the overdose and get you some help. I can write you a prescription for the naloxone if you don't have one, or you can get a kit from our staff. Even if you hopefully will never use it, it's just good to have on hand in case you're ever around when someone does overdose. It could save their life.
Yeah, I mean, that all sounds really scary, but it's good to know that, there are plans that I can put in place to hopefully, prevent that from even happening.
Yeah, so it sounds like you're taking it seriously, and that's good. Let's put the plan that we discussed into place. So we'll lower your dose by a few milligrams now. Please reach out to us and let us know if anything sort of troubling comes up. Don't be shy. I'd rather know about something before a real serious problem happens. So you can always reach out. It's also nothing to be ashamed of if you decide, I don't want to do this, let's go back to my original dose. That's also okay. But hopefully everything will go smoothly, and if